Good evening. Our lecture today is about pneumonia syndromes. Pneumonia can be classified according to a clinical setting into community-acquired acute pneumonia, community-acquired atypical pneumonia, and nosocomial pneumonia. كل نوع من هاي الأنواع لازم نعرف السبيسيفيك organism اللي يسوي clinical features, radiographic pattern and pattern of inflammation. Regarding the community-acquired pneumonia, most common cause of this type is bacterial, and most common bacteria is Streptococcus pneumonia. يعني the most common cause of community-acquired acute pneumonia is Streptococcus pneumonia. What are the risk factors for streptococcal infection? Risk factor could be either chronic disease, يعني البيشنت عنده congestive heart failure or chronic obstructive pulmonary disease or diabetes يكونون معرضين more susceptible to pneumococcal infection, or patient have congenital immunodeficiency such as selective immunoglobulin A deficiency or acquired immunodeficiency such as AIDS. لو البيشنت عنده decrease or absent splenic function، decrease يصير في حالة الهيماتولوجيكال diseases such as sickle cell disease، والabsent إذا patient مسوي سبلينكتومي. فالبيشنت اللي عنده وحدة من هاي الريسك فاكتور يكونون معرضين إنه يصير عندهم streptococcal pneumonia. Other causes of community-acquired acute pneumonia include Haemophilus influenza and Moraxilla catarrhalis. Regarding the anatomical distribution، يعني pattern of inflammation in community-acquired acute pneumonia, the inflammation occur either in form of patchy distribution. patchy distribution يعني اكو مناطق بيها inflammation ومناطق ما بيها، وهذا اللي patchy distribution could occur in one loop or more. يعني مثل ما تلاحظون هنا عندنا الرايت لانج بيها الميدل لوب واللور لوب اثنيناتهم affected by inflammation. هذا النوع نسميه برونكو نيمونيا اللي يصير بيه patchy distribution of inflammation. أول inflammation قد يكون بشكل involvement of entire loop، يعني ماكو مناطق تخلو من inflammation كلها inflamed، وهذا النوع نسميه lobar pneumonia. Regarding stage of infection، عندنا 4 stages of pneumonia infection. Start with congestion. إيش نقصد بالcongestion؟ مثلا هنا عندنا الالفيولاي وهنا الكابيلاريز. الcongestion معناته الكابيلاريز become filled with blood and inflammatory cells. وعندنا scattered neutrophil and bacteria inside the alveoli، يعني راح يبدي يصير exudate، يعني movement of fluid from blood vessel into the alveoli، وهذا الفلويد rich with protein لذلك نسميه exudate. هذا الexudate شبيه inflammatory cells such as neutrophils والبكتيريا inside the alveoli. المرحلة الثانية اسمها rate hepatization. شنو rate hepatization؟ يعني اللنج تصير liver like consistency، القوام مالتها يشبه الليفر. شنو الكاركترستيك histological features؟ air spaces or alveoli become filled with a neutrophil, red blood cell and fibrin. يعني همين راح يصير exudate و increase inflammatory cell in form of neutrophils. إضافة إلى ذلك راح يصير أكو RBC inside the alveoli اللي هي تعطيها اللون والconsistency مال الليفر مثل ما موجود بهاي الصورة. شو تلاحظون هنا هاي red hepatization. الستيج الثالثة هي grey hepatization. بهاي الستيج راح يكون اللنج على شكل grey رصاصي و dry and firm in consistency، ويصير grey لأنه الRBC راح يصير بيها lysis and destruction. مثل ما هو موضح بهاي الصورة هاي. هذا example of lobar pneumonia، يعني involvement of entire loop، وصاير لونه تقريبا grey to white. The final stage of pneumonia infection is called resolution. إذا ما صار complication إيش راح يتطور؟ راح يتطور إلى resolution. بالresolution الإكزوديتس راح يصير بيه digestion by enzymes و converted into semi-fluid debris. هاي semi-fluid debris either ingested by microphage or تطلع عن طريق الكف. Histological examination in patients with community-acquired pneumonia demonstrate the presence of exudate and inflammatory cell inside the alveoli. Regarding the complications of pneumonia, it may cause tissue destruction and necrosis, result in abscess formation, or an inflammatory cell and bacteria may extend into the pleural space and will result in empyema. It may cause fibrous scarring of the lung, or the bacteria may disseminate into the blood, into systemic circulation, and cause infection in various tissue and organs such as meningitis, arthritis, or bacterial endocarditis. Regarding the clinical features, the onset is usually abrupt. Abrupt means sudden onsets, with high fever, chills, and pleuritic chest pain. pleuritic chest pain معناته ال pain occur during inspiration، يعني يصير من ياخذ نفس. Productive purulent cough، يعني cough with large amount of sputum, and the sputum may be yellow to grey or may contain blood. May present with signs and symptoms of complication. Regarding the examination, the patient has decreased breath sounds, tachypnea, which is increased respiratory rates, crackles, and dullness on percussion. These both signs occur because the alveoli are filled with fluids and inflammatory exudates. لذلك يكون dullness on percussion والفلويد يسوي لنا crackles. Regarding the investigation, we can perform complete blood counts. نستفاد من عدة نعرف number of white BC والwhite BC differential، يعني mostly نشوف النيوتروفيل عالي. Other investigation include sputum stain and culture حتى نعرف specific type of microorganism, and most specific is blood culture, which is positive in about 20 to 30% of cases. Regarding imaging, we can perform chest X-ray. This chest X-ray of bronchopneumonia demonstrates patchy inflammation, which is usually bilateral and basal. Regarding lobar pneumonia, we have an involvement of middle loop in the right lung.